Hi, I'm Kara, and today I'm going to show you how to properly move a client up in the bed, as well as moving them from the bed to a chair. So the first thing we want to do when moving a client up in bed is that we want to raise the bed to a comfortable position to work with. And you're going to do this with two people, one on this side and one on the other side of the bed. And both of you are going to lower the bed rail. You're going to make sure they have a draw sheet underneath them. You're going to have it rolled. You want to make sure that whenever you're going to move them, they're in a flat position. Your front foot is facing forward and your back foot is facing angled towards the bed. You're gonna shift your weight, moving from the back to the front to the direction that you want to move the patient, and you're gonna count to 3. So I would go 1, 2, 3. I move back, and then we're gonna move that direction to the front. So if I had another person here, I'd demonstrate that, but for the purposes of this video, we're just going to have me and my trusty friend here, Lainey. So after you're done with that, you want to make sure you raise the side rail, give them a call light, and make sure that they're okay, drinks in reach, and side table, and lower the bed back. So that is how to move a client up in the bed. The next step we're going to do is I'm going to show you how to properly get a person out of bed. You want to make sure that the bed height is in a comfortable position, so raise the head of the bed to a comfortable position to where they are sitting up. You doing okay?
Yeah.
Good. And then once the bed is moved and she's properly sitting forward, I'm going to make sure the chair is within reach, and I'm going to go ahead and drop the side rail. All right, I'm going to help you move your legs now. Are you ready? Okay. All right. Then I make sure I have my gait belt, and it's adjusted to the size of my client. And make sure you put 2 fingers underneath to make sure it's not too loose or too tight. And so I'm gonna leave her here, sit for a minute, just to make sure that she's not dizzy and she's doing okay. Are you dizzy or?
No.
Okay, you okay to move now?
Yeah.
All right, so I'm gonna take my hands from under the gait belt, 1, 2, 3, and help her lift. And then, are you okay to move now?
Yeah.
So make sure she's not dizzy before we move. We're gonna step to the side. And then once she can feel the back of the chair with her legs and grab the rails, we're going to make sure she's seated. And that is how to move a client. Thank you. That's how to move a client out of bed to a seated position. Thank you.